So the COMPEL trial is a open label trial that was a phase 4 trial, and it looked at patients who had chronic migraine. And the definition of chronic migraine requires that you have more than 15 headache days a month, with 8 of them being migraine days. And it enrolled patients like that and treated them sequentially every 12 weeks for 9 treatment cycles. So the total duration of the trial was 2 years. And during that 2-year time period, we saw reduction in headache days. So if you took the whole population, at baseline, they had 22 headache days. And as they progressed through the trial for the whole population, with each treatment, there was a sequential decline. And on average, they declined between 10 and 12 days by the time the 2 years had passed. If you looked at a sub-analysis of the percentage of patients who switched from having more than 15 days a month of headache to less than 15 days a month of headache, that would imply that these people were very well controlled in terms of their chronic migraine. We don't think of chronic migraine as a disease that disappears. We think of it more like hypertension. So if you're controlling hypertension, you're on a treatment, your blood pressure reading is normal. So this is the way we would look at this group of patients, that you had 15 days or more, 22 days of headache on average. Now you're well controlled and you have less than 15 headache days a month. What percentage of patient meets that criteria? The interesting finding in this analysis is that it matched pretty closely with the 50% response rate. So when you look at the response rate, we look at getting 50% better from baseline. We see, what percentage of patients meet that number. And it was closely aligned with the number that we're now dropping below 15 days a month of headache, which suggests, patients that were in the trial were pretty bad. They had frequent headache. And in order to be well controlled and get below 15, essentially they needed close to a 50% reduction in their headache days to achieve that. Chronic migraine is a very difficult disease to manage. And it's a particularly difficult disease to get under good control. And so the fact that we could do this over a 2-year time period is not an easy feat. Not many drugs have been tested for that long, and shown the benefit like this. What has been tested and is similar to this is the monoclonal antibodies that are directed against CGRP. But if you look at oral treatments that historically have been used, this type of data has not been done for that population. Now, part of the reason is that chronic migraine is an entity of migraine that Botox is specifically used to treat. It's a subtype of migraine that Botox is approved for. And so the counter argument for the oral medicines, why they haven't studied this specific population, is that they've been used to treat migraine in general, not this subpopulation.